Good evening. My name is Cody Best, and I will be presenting on cervical radiculopathy. I will be covering the issue of interest, its background and significance. I will then introduce you to my PICO-T question and dive into my search strategy and findings. I will then make a clinical decision based on the evidence. The issue of interest is cervical radiculopathy, the clinical condition resulting from compression of cervical nerve roots, according to Iyer and Hahn. The background of this is that for over 3 years now, I myself have been suffering from cervical radiculopathy. I'm not the only one, because according to Eubanks, cervical radiculopathy is common in 83 per 100,000. Therefore, my PICO-T question is that for patients with non-surgical radiculopathy, how do non-surgical treatments, physical therapy, and steroid injections influence the pain level and range of motion as compared to surgical treatment after 1 year? My search strategy included the databases PubMed Central, the National Center for Biotechnology Information, and Science Direct from Arizona State University's library. My keyword was cervical radiculopathy, but the Boolean connectors were treatments of and the recovery from cervical radiculopathy. My findings were initially 5 resources that impacted nearly all aspects of my PICO-T question. 4 prominent studies were the steroid injections, surgical procedures, and physical therapy rehabilitation. I'd like to say, however, only one study continued on for 24 months. It concluded that neck-specific training and exercising combined with behavioral approach was favorable for long-term physical care. The most common study design included the Neck Disability Index to compare measurements. The first study covered was the steroid injections of 40 recipients. All 40 received local anesthetics, but only 20 received steroid injections while the other 20 received saline. This had level 2 evidence, and the outcome was that only 8 of the 20 receiving steroid injections reported positive outcomes lasting after 1 week or more. The second study had level 3-3 evidence and is possibly the largest case study known of. It was the review of over 1,400 surgical interventions. It concluded that cervical discectomy and fusion was the most common procedure with more than 50%. Its rate of revision was 6.4% after an average of 3.3 years. Only 11% of that, or 10 cases, was due to persistent radiculopathy. Lastly, 2 studies on whether or not specialized rehabilitation was more beneficial than conventional rehabilitation. These both had level 2 evidence because they were randomized clinical trials for 180 patients. The outcome from these studies showed that both conventional and specialized rehabilitation routines benefited activity at the end of the studies. Unfortunately, there was not much difference between the 2 rehabilitation methods. To conclude, my clinical decision is that because of the root block with steroid injections having lacking impact makes me wary of its implementation, and the physical therapy studies having similar outcomes is reassuring, but it's still undetermined if it's beneficial past 24 months for reducing pain levels and improving range of motion. Therefore, with the low rate of revision, surgery will still remain a fallback option, so I'm deciding to continue with physical therapy treatment until it becomes ineffective before inquiring further about surgical options. This has been my presentation. Thank you.